Hello and welcome to Acoustic Bulletin. Again, we have an interview here with Kerstin Persson-Waye. Kerstin is a professor in occupational medicine and environmental medicine at Sahlgrenska Gothenburg University. Welcome.
Thank you.
And thank you for being here. First question, what brings you to Internoise?
I think it's good to go to Internoise, try to go every year to get an overview of the latest research in my areas.
Any specific responsibilities that you have today?
Today I'm chairing the session in noise and healthcare facilities, and I'm also listening to my colleagues' presentations in occupational noise and in wind turbine noise.
Yeah. Are you involved in presenting a paper yourself as well in this session?
I'm presenting a paper in the healthcare section, yes.
So you're both chairman as well as presenter?
Yes.
Okay. What topic do you think is most interesting so far, the lectures that you have visited?
I think it's been lots of interesting presentations at this conference, but my interest now is mainly in children's response and how the children are affected in school and preschool environment. I also think that the effects on patients and personnel in healthcare is a very important topic.
Why is that important?
It's important because we think that the sound environment is of importance for the recovery for patients, and it's also important for security purposes in the hospitals, but also we think that the sound environment affects personal's ability to work well and to stay well.
Have we performed enough research to make hospital boards aware of the benefits?
No, I think we are just in the beginning of that area, and there's lots of things to be done, of course, asking a researcher. But we're definitely in the beginning of that field.
Thinking about that, making research, if you had an unlimited budget, and regardless of whether it comes from Megaphone or another company, what would you want to explore?
I think my priority would be to explore the effects that these high sound levels in preschools and schools have on children and personnel. My second priority would be to try and evaluate the effects of the sound environment that we have in healthcare facilities, mainly on patients' response, physiological response, and how their sleep is affected. Yeah.
Is there any study ongoing right now that you're involved in?
Yeah, we're actually doing experimental studies looking at sleep disturbances from intensive care unit sounds.
And who is we in that case?
It's the sound environment group at the Sahlgrenska Academy, Gothenburg University. Yeah.
Okay. What advice would you give an end user when he's planning for a new building to secure a good sound environment?
It depends, I think, on what type of activity the room is going to be used for. Very much so. So there's really no clear answer on that question. But if I would advise the end user to consider the sound environment or the acoustics much more than it's usually done.
Are they fully aware of the benefits already, you think?
No, it seems as if the sound environment is usually the lowest priority in building and planning, unfortunately.
Yeah.
Even though it affects people quite a lot, so I would like it to be a higher priority. Yeah.
There's a couple of hospitals that put their ambitions a little bit higher.
Yeah, definitely so. Definitely so. There are hospitals that are actually considering the sound environment more than others. Yeah.
Okay. One bonus question. Who do you think will win the World Cup? Kerstin is from Sweden, so it cannot be Sweden. They're not in.
Oh, it cannot be Sweden. Oh, then I would vote for Brazil.
Brazil. Thanks a lot.
Thank you.